Dementia in psychiatric terms is a neurocognitive disorder. Typically, it happens when there's deterioration or degeneration of some regions of the brain, which can affect someone's memory, their ability to plan, organize, sustain attention, or care for themselves. It usually happens later in life, maybe starts around the age of 70, and it can be seen with someone who's having difficulty with their finances and balancing checkbooks, forgetting how to drive home, so they're not able to get groceries. Maybe they have some help to get groceries, but they are not able to cook, like they forget to turn off the stove when cooking. And it could advance to where they're unable to care for themselves, either bathe themselves or feed themselves in general, and they just need someone to take care of them. So memory loss is a normal part of the aging process, but there are ways to slow down this process so that it takes longer for dementia to come. So I'm going to talk to you about 6 tips to help prevent dementia. First is eat healthy and exercise regularly. Medical conditions like obesity are typically associated with higher chances of earlier dementia. You want to treat clinical depression. Depression is one of the psychiatric diseases that can lead to early dementia, so be sure to treat clinical depression as effectively as you can, either by lifestyle changes, medications, therapy, or a combination of all the above. Also treat underlying medical conditions. High blood pressure can lead to strokes, and strokes can also cause dementia. So be sure to treat high blood pressure. Also other conditions that can clog up the arteries, like cholesterol, blood sugars, etc. Be cautious of alcohol or illegal drugs. I cannot tell you how many times I've seen people with early dementia that cannot take care of themselves just because in their adulthood they use copious amounts of alcohol or illegal drugs, and it just messes up the brain. Fifth is the notion if you don't use it, you lose it. Seems like a general principle for a lot of things. Do activities that require brain power or challenges your thinking, maybe learning some new skills, maybe can help prevent dementia from happening. And be social. It's thought that social connection seems to help decrease one's chances of dementia. Like dementia is a really difficult disease to treat. In fact, we don't really have many treatments for it these days. It can often start off as psychiatric symptoms. People who are older, maybe it's anxiety, depression, mood changes, paranoia, and then over a course of several years, it can progress to someone not being able to take care of themselves, like the ways I just mentioned. And it gets to a point where they can't take care of themselves completely, and they need 24/7 care for the rest of their life. So dementia is a really challenging disease. It affects a lot of the population these days. So do your part in trying to help yourself or help others to slow the spread of dementia happen.